Hello, Assalamu alaikum. In this video, we will understand about the polyarteritis nodosa. It is known as the medium vessel vasculitis. The medium vessel vasculitis means the vasculitis is the inflammation of the blood vessel, and the blood vessel is the medium. In this video, we will understand about the polyarteritis nodosa, systemic necrotizing vasculitis of medium-sized vessel vasculitis. Let's understand about the whole story. So first of all, we will understand about the clinical feature, non-specific symptom. So first of all, we should need to understand the clinical feature. This is the descending aorta and the aorta of the heart, and this is the aortic arch is the large vessel vasculitis, but the renal artery is the medium vessel vasculitis, while the other is a small vessel vasculitis occur. But in this video we will focus on the medium vessel vasculitis in the renal region, in the kidney. So in the another also the blood vessel. So the non-specific symptom is the myalgia and the mononeuritis multiplex. In this way, the vasa nervorum is the blood vessel surrounded the epineurium, and this lead to neuropathy and the nerve degeneration due to the less blood supply to the nerve. The other is on the skin arise the rashes, purpuric rashes, subcutaneous rashes, bulbous vesicular lesion, livido reticularis. On the other hand, the weight loss and the fever is a major sign and symptom, and the vein specific abdominal pain can be occur. Anyhow, on the other hand, the renal region, what will be happen in the renal region? Basically as the renin will produce more due to the vasculitis, and in this way the hypertension will occur due to the production of renin. Due to the production of renin, it will basically will lead to hypertension, and this is another mechanism which that is due to the constriction of the blood vessel, and the nephropathy will lead to produce renin more, and nephropathy can occur. On the other hand, let's understand about the bigger picture. Is here is the tunica adventitia and smooth muscle layer, as well as here is the endothelial cell layer. This dendritic cell will sensitize the antigen, will lead to activate the CD4 and 8, will lead to cause inflammation due to the production of cytokines. In this way, the smooth muscle cell will be inflamed. On the other hand, the endothelial cell also cause the inflammation. Why? Let's understand about this. This is the antigen in the blood circulatory system in the lumen. The allergen, virus or bacteria interact with the antigen presenting cell. In this way, it will go toward the lymph node. When going toward the lymph node, antigen presenting cell will activate the T helper, naive T helper CD4, and it is known as the activation of T helper cell. And in this way, the CD4 will be co-activation, will lead to recruit the CD8, and this CD8 will recruit toward the T helper CD4, will lead to cytotoxicity will occur. In this, the endothelial rupture will occur due to the CD8 cytotoxic T lymphocyte will activate. On the other hand, the T helper cell, the CD4, which that also activate the B cell to produce plasma cell after the proliferation and produce cytokines to recruit B cell. And the B cell will produce the plasma cell after the proliferation will lead to produce the IgE antibodies. These IgE antibodies mimic the molecular mimic to autoantibodies formation will lead to bind with the endothelial cell to rupture it, and inflammation will occur and recruit through cytokines the macrophage and neutrophil for as well as monocyte for the further inflammation clearance. And in this way, the progressive inflammation will lead to dendritic cell immature, will lead to recruit the CD4 and 8, will lead to also produce cytokines, and CD4 and CD8 will lead to rupture the a smooth muscle layer. In this way, the inflammation will progress. On the other hand, the endothelial cell dysfunction will lead to permeability of the neutrophil, and in this way, the neutrophil infiltration toward the inflammation site for clearance the inflammation, but it will progress. And the endothelial cell will rupture to produce cytokines, and wall debris will lead to activate the complement system. This complement system will lead to endothelial lysis, phagocytosis, plasma of cells and cytokines, and inflammation due to the inflammatory mediators production. Anyhow, these CD4 and 8 will lead to trigger the inflammation further, and on the other hand, the endothelial cell as well, and CD8 and 4 also. But also the plasma cell produce antibodies as autoantibodies bind with the neutrophil toward the light chain of the antibodies binding site to activate the immature neutrophil activation. This is the autoantibodies, and attack on the neutrophil will lead to activate but immaturely to produce cytokines, and inflammation will progress. Anyhow, further is the inflammation will progress, and in this way the injured wall debris will lead to macrophage recruitment for the clearance of these debris and neutrophil and macrophage, and in this way the injured wall will lead to hemostasis and platelets plug formation and coagulation. This coagulation will lead to cause many problems like impede the blood flow, and the blood flow will not occur easily, and necrosis will occur in the smooth muscle layer, and inflammation will progress. Mast cell activation lead to anaphylactic shock can occur. On the other hand, the dendritic cell also, so in this way the thrombosis, stenosis, ischemia, the hypoxia and hypoxemia will occur in the blood circulatory system, the low level of oxygen due to the less availability, and the aneurysm will occur, the hypertrophy of smooth muscle layer will progress. On the other hand, the ruptured blood vessel will lead to hemorrhage. This will lead to a regrowth of endothelial cell. In this way, the growth factor will be activated, and in this way, the rupture of the smooth muscle layer cell will lead to fibrinonecrosis will occur, and the fibrin deposition, collagen, proteins, and other will lead to cause aneurysm, and that is why this is the major function. So let's begin to understand the investigation, and then we will understand about the management. So the investigation is the microaneurysm angiography. The angiogram will use to biopsy as well. Also biopsy and microaneurysm angiogram, and the viral hepatitis serology, the full blood count, and urea and creatine measurement in the blood. On the other hand, the management is the glucocorticoids, and different types treat the differently. The different type of polyarteritis nodosa will treat with that differently, but the glucocorticoid is the major. But on the other hand, also the anticoagulant can use the drug. Anyhow, the polyarteritis nodosa is the medium vessel vasculitis, which that will lead to cause many complications like thrombosis, stenosis, ischemia, aneurysm, rupture, blood vessel. I hope you make sense about that. If you like my video, please make sure to subscribe, like and share. And I hope you enjoyed this video. See you in the next video for this time. Bye. And I am also making another videos. You can watch that like biological.